A while back, I was working with one of my favorite partners and a student of some sort when we ran a patient with a low systolic blood pressure, something like 80 millimeters mercury. I don't remember the patient specifically, but I think it was a GI bleed with hypotension and tachycardia. When I loaded the patient into the bus, I noticed that the legs of the pram were elevated in the Trendelenburg position. I did what I always do. I lowered the legs so that the patient was lying flat. We farted around for a few minutes on scene, starting IVs and whatnot, and transport was initiated. I noticed that the patient's legs were up in the air again. I put them back down. Again. Hi, this is Angry Bill for Prehospital Wisdom. Once again, this is one of those videos where I need to point out that I'm not your boss, I'm not your medical director, I'm not your QA coordinator, and I'm not your protocol author. But enjoy anyway. I'm trying to get to 1,000 subscribers, but to get there I have to hit 100 first. So make sure to subscribe if you haven't, or share this with someone if you have. Your help's appreciated. Anyway, I hate Trendelenburg. More specifically, I hate the Trendelenburg position. I have nothing against Friedrich Trendelenburg, the German surgeon who first described the position in 1873. He used it to improve his view when performing abdominal pelvic surgeries. Inverting the patient pulled the superior organs downwards off the pelvic organs he wanted to work on. He also described the Trendelenburg gait, Trendelenburg sign, Trendelenburg's test, Brody-Trendelenburg percussion test, the Trendelenburg cannula, and Trendelenburg's operation. I'm always jealous of people who are badass enough to get something with their name on it, and this nut throws at least 7 of them out there. It makes me feel like my life's been wasted. To me, a provider still using the Trendelenburg position is a sign that EMS providers simply copy the medics who taught them, who copied the medics who taught them, ad infinitum back to the 60s and 70s. Hell, in this case, it must go back to 1873. This is no way to improve the provision of pre-hospital care. If medicine followed that model, we'd still be leeching the bad humors away. We need to stop being idiots. So I was taught that gravity would help pull the blood in the lower extremities superiorly, thus increasing cardiac filling, stroke volume, and cardiac output, helping to perfuse the brain and increase the blood pressure. Unfortunately, there's no proof of this. It's close to the same logic that went into masked pants. Even more unfortunately, and exactly like with masked pants, there's some indication that the Trendelenburg position makes patients worse off. So, in 2004, Johnson and Henderson published a meta-analysis that found, quote, evidence to date does not support the use of this time-honored technique in cases of clinical shock, and limited data suggest it may be harmful. In 2005, a literature review of the Trendelenburg position article stated, the literature on the hemodynamic effects of the effectiveness of use of the Trendelenburg position in treating hypovolemic shock is small and does not reveal beneficial or sustained changes in systolic blood pressure, preload, afterload, or cardiac output. Shamus and Clark in 2007 found that research does not support the use of Trendelenburg position as an intervention for hypotension. In 2008, Best Bets meta-analysis found adverse consequences associated with the position and does not recommend using it. In 2016, an EMS1 article by Engel does not recommend Trendelenburg position and explains that patients with head injury and or respiratory difficulties should not be placed head down. No kidding. Even frickin' Wikipedia is not down with the Trendelenburg position. Wikipedia! I could keep going and even get into the literature upon which the meta-analyses are based, but I'm not sure most of you would read it. What it comes down to is that the Trendelenburg position isn't doing what you think it's doing. It may cause venous pressure increases in the brain, probably interferes with immobilization, may cause nasal congestion that interferes with respiration, and can push abdominal contents against the diaphragm, impeding its free movement. In addition, there appears to be no effect on systolic blood pressure or cardiac output, so what we're trying to accomplish is not being accomplished. The best position for a shocky patient is probably supine, even with the head slightly elevated if the patient's more comfortable like that, or if they also have a head injury. If you're a hardcore Trendelenburg proponent, it's on your shoulders to find evidence to support your position. Go ahead. We're waiting. Leave some breadcrumbs in the comments below. Stop with the Trendelenburg position, please. Spend your time doing something productive with these patients. You made it this far in the video, so you may as well subscribe and like the video. It helps more than you know to get the word out. What's the word we're getting out? that medicine is medicine, but pre-hospital providers have specific knowledge, skills, and attributes that other providers don't regularly use. Once again, this is Angry Bill from Pre-Hospital Wisdom, and until next time, stay safe.